let's dive right in. We're here to talk about a pretty fundamental shift, a new way of thinking about how your commercial teams engage with healthcare providers. We call it the new mission, and honestly, it's the future of engagement in pharma.
To really get what this is all about, let's start on the ground. Picture this. We're in Florida, in territory X001 SFL. And for your company, this isn't just a place with nice weather. No, this is a critical battleground where the fight for your star product, Med-X, is won or lost every single day. And that battle, well, it just got a whole lot tougher. Let's break down how the entire landscape has changed because a new competitor has just entered the ring. For years, Matirix has been the king of the castle. It's been the go-to treatment for psoriasis, a trusted leader in the American market. It's a product your teams know how to sell inside and out, and it's one that physicians have come to rely on. But a few months ago, everything changed. A new challenger, Medi, hit the market, and it is gaining ground fast. I mean, just look at the side-by-side. Medi's big claim is a 10% faster time to 90% clearance. And in a market this competitive, you know that a single data point like that is more than enough to turn a physician's head.
So how does this all play out for your people on the front lines? Well, this gets us to what we call the rep's dilemma. They're stuck using old tactics to fight a brand new war. And right in the thick of it all, we've got your best, right? He's a seasoned pro, he's seen it all, a multiple President's Club winner. The last time he launched a huge product like this, Destiny's Child was at the top of the charts. The point is, he knows how to win.
And this is the crucial part. The world of pharma has changed so dramatically since the year 2000. The very playbook that made Larry a star, well, today, it's dangerously out of date. The data really tells the story here. Back in 2000, it took about 15 years for 3 or more competitors to show up in a market. Today, that window has shrunk to just 2 years. The competition is showing up faster than ever before.
And what does that actually mean for your bottom line? It means the window you have to get 50% of a product's lifetime sales has been cut by 18 months. You have so much less time to make your impact before the market gets crowded and those margins start to shrink.
Larry is an absolute star, no question. But in this new world, he can't just rest on his laurels. All his experience is invaluable, but it's not enough anymore. He needs a new kind of support. He needs help. And that help is exactly what we're proposing. It comes in the form of a completely new playbook. We call it mission-based engagement.
So what is mission-based engagement? At its core, it's a system that uses the power of analytics, AI, and data to give reps like Larry the exact intelligence they need to win those daily battles.
Let me contrast this for you. The old way, which really hasn't changed in 20 years, was basically a broad mandate. Just go out and drum up prescription volume. It was a numbers game, all about quantity. The new way, the mission-based way, is all about precision. It's about engaging the right provider at the right time with the right message. It's about quality, it's about impact.
Now, this all sounds great in the presentation, right? But how does it actually work? Let's pop the hood and see exactly how one of these missions comes to life for Larry when he's out in the field.
So, our systems are constantly scanning Larry's territory, looking for these little signals in the data that mean something big. For example, bing, it detects that Dr. Howard Stern, a top prescriber, just wrote a script for the competitor for the very first time. Or, bing, it flags that Dr. Galvan's Med-X volume is dropping off. And hey, it also identifies that RN Jamie Fretz, who has huge potential, isn't being seen nearly enough. These are the signals that really matter.
Now, this is a super complex web of information, right? It's way too much for any one person to track. So our system does all the heavy lifting. It takes this flood of data and translates it into clear, simple, and actionable goals for Larry.
The process itself is a simple but really powerful loop. First, the data triggers an observation. Second, a new mission is automatically created from that. Third, a step-by-step actionable plan is delivered right to Larry. And fourth, and this part's key, his feedback and the results of that mission are fed back into the system, which makes it even smarter for the next time. It's a constant cycle of improvement.
So what does this actually look like for Larry? He gets a notification. It's a new mission. Engage Dr. Howard Stern. But it's not just a name, it's a full briefing. It tells him the next action is a specific in-person call. It gives him a key piece of intel. Dr. Stern is really focused on respiratory adverse events. And then it hands him the perfect talking point. Bring up the latest study on Med-X's excellent safety profile. See, this isn't just a sales call, it's a precision strike.
Now, just take that effect
and multiply it across your entire sales force. That's the future of pharma sales. We're talking empowered, we're talking effective, and we're talking incredibly efficient.
Okay, I know what you might be thinking. You're looking at the AI, the data models, all the analytics, and you're asking a totally fair question. Is this going to be too complex for my sales force to actually adopt? And the answer to that is a resounding no. Because all of that complexity, all the data processing, the predictive modeling, the analytics, all of it happens behind the scenes. For Larry, the person actually using it, this system is beautifully simple. It's as easy as just logging into his CRM, the mission, the insights, the talking points. It's all right there, waiting for him. It frees him up from all the administrative guesswork and gives him more time to do what he does best, building relationships and engaging physicians. This is what mission accomplished really looks like. It's an intelligent, data-driven commercial team that is more precise, more effective, and always one step ahead. This is the future of engagement, and you can build it today.
So I'll leave you with this final thought. Medi is just one competitor. The next one is already on its way. Your competition is getting smarter every single day. So the real question is your team equipped for their next mission?